Maybe.
Okay, Alderwoman Spencer, you can now begin the meeting.
Thank you, Madam Clerk. I'd like to now call the meeting of the Health and Human Services.
Thank you. And I know that we've had a lot of conversations with Verizon, and they're the ones, right now getting a lot of polls up. I don't know what it's going to be like working with, AT&T.
I'd like to now call the meeting of the Health and Human Services Committee now to order. I recognize we have several members that are in two committees, but Madam Clerk, would you please call them?
There's not even necessarily too many other.
Alderwoman Ingracia. Alderwoman Tyus.
Present.
Alderwoman Green.
Present.
Alderwoman Martin. Alderwoman Navarro. Alderwoman Middlebrook.
Present.
Alderwoman Rice.
Present.
Alderman Todd. Chairwoman Spencer.
Present.
Big learning curve that has not been
Alderwoman Ingracia.
pain, but we're learning from that.
Alderwoman Martin.
Attention is securing that.
Alderwoman Navarro. Alderman Todd.
Present.
Rules. So
You have 6 present, a quorum is present.
AT&T.
Thank you, Mr. Clerk. I want to apologize. I didn't realize you'd be handling roll, Mr. Clerk, not Madam Clerk.
That's all right.
Thank you for
I'm secure enough.
Thank you for getting us going here today. Excused Alderman, we have another committee hearing going on simultaneously, of which there are many members of both. So I'd like to hold the excused Alder people list to the end, Mr. Clerk, if you don't mind. Moving on to the approval of the minutes, I'd like to entertain a motion to approve the minutes of our July 13th, 2020 meeting.
I move to approve the minutes of our July 13th, 2020 meeting. Second.
Second,
Excuse me, Alderwoman Navarro asked most of the questions I was looking at asking. One that she did not cover, is there?
Mr. Clerk, would you please call the roll?
Alderwoman Ingracia. Alderwoman Tyus.
Aye.
Alderwoman Green.
Aye.
That by design, or is there any way to ensure that we're not seeing?
Alderwoman Martin. Alderman Navarro. Alderwoman Middlebrook.
Aye.
Alderwoman Rice.
I would say, Alderman, it's all due to where they
Alderman Todd.
Aye.
Chairwoman Spencer.
Aye.
And Gracia, you have 6 aye votes.
Excellent. Moving on to board bills for review. We have 2 board bills before us today. Board Bill 36, introduced by Alderman Todd, who is also participating in the other meeting. Alderman Todd, I'm going to go ahead and switch the order, and that way we can handle your bill after you're done with the Utilities Committee here. Okay?
Thank you very much, Alderwoman Spencer.
No problem. So we'll move on to Board Bill 153. Board Bill 153 is a bill that I'm.
Thanks, Alderman Todd.
This is a bill, it's an ordinance which authorizes the acting director of health, who's with us today, Dr. Fred Eccles, to accept a grant from the Department of Health and Human Services Center for Disease Control and Prevention. It's a cooperative agreement known as the community-based approaches to reducing sexually transmitted diseases. This is an incredibly important matter to be considering here in the city of St. Louis. As we all know, we have incredibly high STD rates as of 2018. CDC data, St. Louis had the highest rates per 100,000 of gonorrhea, chlamydia, and the 4th highest rates of syphilis. We know that this also disproportionately affects people of color, with Black men aged 18 to 29 in the city having a chlamydia rate 8 times that of white men. The same is true of gonorrhea, 13 times higher. And recognizing the interrelated factors of systemic racism, segregation, geographically speaking, and persistent poverty. These are important drivers, and this grant allows us to start to address some of that. I'd like to recognize the Department of Health upon receiving notice of this grant available from the CDC for applying for it and for being awarded. And with that, I'd like to turn it over to Dr. Fred Eccles to explain a little bit more about what this grant will do. Dr. Eccles? Dr. Eccles, you're on mute.
Okay, can you hear me now?
Yes, thank you, Dr. Eccles.
All right, as you mentioned, the city of St. Louis has some of the highest STI rates in the nation. And this has been the case for several years and potentially probably over a decade. And so as the provider of HIV prevention services for the region, the City of St. Louis Department of Health felt it meant necessary to pursue this funding opportunity even during the COVID-19 pandemic. The driving force for this pandemic is also the increase in the rates, particularly among African-American men aged 18 to 29, which is the focus population for this project. And so we've partnered with Williamson Associates, as well as the SPOT, which is a part of Washington University, to make sure that we're engaging the focus population in an effective way, but also learning what some of the social determinants of health are that are impacting STI rates among this population. And so we apply for the grant in May, and as we were awarded the grant, and this grant is a total of $933,121 over a period of 3 years. And again, the focus is to engage the focus population in an effective way, but also implement or incorporate some cultural sensitivity and awareness trainings for the population, as well as providers across the region.
Thank you, Dr. Eccles. Do you have anything else you'd like to add, or shall we turn it over to the committee for some questions?
We can turn it over to the committee for questions.
All right, thank you, Dr. Eccles. With that, I'll go through my committee list here. Vice Chair Heather Navarro is still on the other committee. Alderwoman Valencia, Alderwoman Tyus.
Yes, thank you, Madam Chair. Dr. Eccles, what did you say about the inclusion of WashU? Are you using people from WashU? Is WashU part of the people that is the part of the group that's working with you? I'm sorry, I missed that part.
Yeah, so Washington University has a place called the SPOT, which provides services for youth. And so we'll be working with them. They'll be one of our partners in this grant, but the primary partner will be Williamson Associates, which provides sexual health services and resources for young men of color.
And it's called Williamson Associate, and is that here? That's here in the city of St. Louis?
Yes, it is.
And can you tell me about what Williamson Associate is? I'm not familiar with him.
Yeah, so Williamson Associates is a community-based organization that has a history of providing sexual health services, training, and resources, as well as linkage to care for individuals who screen positive. And so they've been operating for over a decade in the city of St. Louis. They're one of our partners for HIV prevention across the region. And their focus is men of color, particularly young men of color, and the focus population, again, young men of color, particularly those men who have sex with men, because that's where the greatest increase in the cases are occurring.
Okay, and is the partner there, was it Dr. Williams who was the psychologist? Is someone else?
Oh, no, it's someone else.
Okay, and where are they located?
Their primary office is off of Kings Highway, but they also have a location off of Sarah Street, which is called their drop-in center. And last year, they recently expanded to North County because of the increased rates amongst men who have sex with men in that area code. They've been the recipient of federal grants. Right now, they are the recipient of grant through the Substance Abuse Mental Health Services Administration, or SAMHSA, to engage men of color around mental health and behavioral health issues.
And when you say off of Kings Highway, that only goes from Gravois to West Florissant. So what part of Kings Highway are they located off?
It's near the intersection of Kings Highway and Natural Bridge.
Okay. Okay. And so this is a joint, both the city and the county are operating this program, is that correct?
The county will provide some support. So they, we do have a memorandum of understanding between the city and the county, but the city of St. Louis will be the lead. And that's important because the city of St. Louis Department of Health is the lead for HIV prevention services for the region. And we also oversee the Ryan White Part A program for the transitional grant area, which ensures there are social and medical support services for persons living with HIV.
Thank you. I have no further questions at this time.
Thank you, Alderwoman Tyus. Alderwoman Green.
No questions at this time.
Alderwoman Martin, I see you joined us. Did you have any questions for Dr. Eccles? You can go ahead and hold if you want to catch up. Alderwoman.
That's okay. No questions at this time. Thank you.
Alderwoman Middlebrook.
I have no questions at this time. Thank you.
Alderwoman Rice.
Thank you. Dr. Eccles, I am curious, I believe I've been on the health committee here for about 2 years, and I think that we have had funding come through around STIs before, some more grant funding. There's a previous board bill, I think 2 terms ago, that addressed some more grant funding that was available in this area. Can you speak to what kinds of programs we already have in place prior to the deployment of the grants and how effective those have been?
Yeah, so as I mentioned before, the city of St. Louis, we implement HIV prevention activities for the region. And so we receive funding through the state. This funding originates at CDC and is funneled through the state to the city of St. Louis to provide these services. So we do evidence-based, evidence-informed trainings for the community as well as for medical providers who operate in this space. And we also receive direct funding from HRSA, the Health and Human Resources Services Administration, for the Ryan White Part A grant, which again ensures that we're able to provide social and medical support services for persons living with HIV. That particular funding opportunity covers 12 jurisdictions, 5 in the state of Illinois and 7 in the state of Missouri.
Okay. Have we been able to, it seems like the news keeps saying we keep increasing rates keep coming up, STIs and HIV specifically, but STIs in general. Have we been able to make a dent in any of these rates?
For the last few years, it has actually been relatively increasing, but then we also have to look at the denominator. So when we look at what's happening in the city of St. Louis, we have a smaller denominator, but when we look at what's happening in the metropolitan area, it's similar to what's happening in other jurisdictions, but that's not to underplay how essential it is to make sure that individuals are properly protecting themselves and they're aware of their sexual and behavioral health. One of the issues that we have that has been a problem for decades is the stigma around sexual health. That goes from how sexual health and sexual and reproductive health trainings are provided in schools, as well as how comfortable people are in the community about having discussions about sexual and reproductive health. The stigma has been a huge barrier that continues to perpetuate a lot of the issues that we see among populations that are the most vulnerable and carry the highest burden of STIs.
Sure. That's a really great point. Are there in St. Louis public schools, in the charter schools, do you know what is the sexual health and reproductive health programming look like in our schools right now?
So for a lot of them, they've actually contracted out to other providers. That has caused some issues within the last 3 or 4 years. I know that was an issue with some of the religious groups providing the training because of the religious context that was placed on the material. And so that has been a challenge. When I was with the county, we actually secured funding for through the National Associations of City and County Health Officials, but schools weren't at that time at a place where they were able to tackle sexual and reproductive health because of the political issues and associated with it and the stigma.
Absolutely. Okay. Yeah. Thanks so much for answering those questions. I know this is an excellent source of funds, and I'm glad for it. I just wish that we could make a dent in this, bring those numbers down. I'm hopeful that the money will help expand those programs, and we absolutely need to look towards better sexual and reproductive health programming in our schools, I think, if we're really going to tackle the issue. So thank you so much.
Alderman Rice. Alderman Todd, do you have any questions?
First of all, Madam Chair, thank you so much for rearranging my bill. And I want to thank Dr. Eccles for the education and the resources that he brought to the health department. I don't have any questions.
Thank you, Alderman Todd.
We were able to launch our first site.
Make sure everybody's muted.
About 2 weeks after the first hospital sites opened up. And we opened up our county site.
Make sure everyone's muted. I think we're having a hard time here.
We were able to do that predominantly because
okay, Dr. Eccles, I had a couple of follow-up questions along the lines of the Alderwoman from the 8th. Looking at our current program, you mentioned a few grants that we get. Are we putting, is there any general funding? What is the total amount of expenditures towards STIs from the city of St. Louis look like? What is our, total budget for this program? Do you have those figures handy? I think Dr. Eccles got muted in the mix here.
Sorry about that, I was muted again. So for the Ryan White Part A program, we received a little over $6 million for that, but again, it covers 12 jurisdictions. And for the HIV prevention, we receive about $850,000 per year from the state. And then there are some general funds that go to, that are dedicated for disease investigation and some HIV prevention activities.
And does that money go towards testing, for example? If you, suspect that you may have been exposed, are you able to get a test in the city of St. Louis?
Yeah, so there are several sites. So we launched a website called stlcondoms.com, which allows individuals to access sexual health resources and services. We also put together a pamphlet for community members to distribute that shows individuals where they can get HIV sexual health screenings at low or no cost.
What was the name of that website, Dr. Eccles? I'm sorry, I didn't hear that.
stlcondoms.com.
stlcondoms.com. That's a St. Louis City funded website.
No, so it was one of our partners actually created it a couple of years ago. We worked with them to update it, and right now it's not owned by the city, and so we're working with them to actually to address that.
Okay, I just popped on there right now. Is there anywhere to get treated, or get tested in the city?
Yeah, so there are links on the site that you can click on that shows you where the testing sites are, and some of the testing sites also provide treatment.
Okay, I only see treatment on here. I don't see any testing.
Okay, I have a presentation I have to give, so I'm going to have to log off and log back on.
Say that again.
I have a presentation I have to give for WashU, so I have to log off and log back on.
I think the point that you made about the underfunding of public health is
I think we'll go ahead and wait for Dr. Eccles to join us again. It sounds like Dr. Eccles has to give a presentation. I'm not sure if that means that Dr. Eccles will no longer be with us.
I think he said he would have to log out and then log back on when he's done with that presentation.
Okay, so we'll go ahead and hold this until we can continue to discuss it. I think we'll move on to Board Bill 36 in the meantime. Hopefully Dr. Eccles will be able to join us again momentarily. Alderman Todd, you're recognized on Board Bill 36.
Okay, Board Bill 36 is asking the city to support drug treatment for all on demand. And my information from, first of all, verbal information was from the chief of police. I've heard him say most of the killings are drug related. And then also most of the people down at the workout, since many of the people down at the workout, for example, and in the Justice Center are there because of drugs and drug related crimes. Also, there are some books and studies, like for example, it's a book called Sex Work, which is the writers Federico de Castro and Priscilla Alexander. The study shows that many of the females who involved in prostitution and other sex in this, many of the women involved in the sex industry, including those who are kidnapped and forced into sex kind of slavery and other things, are drug addicts and prostitutes as well. Junior, which says locking up our community, shows that many of the killings, many of the crimes are drug related. Then there's another book called The Urban Plantation by the authors Robert Steele. It shows that we could probably reduce crime, cut crime in half if we could really reduce crime if we had drug treatment in our city. So in fact, I would say this: we cannot, according to studies, we cannot eliminate the what we call the food desert without treating drug addicts, because stores will not be able to operate in certain areas, especially in certain areas, without us treating drug addicts, because drug addicts have to have drugs as well as have to live, because many of them are in the homeless population and can't afford to get their drugs unless they live off other people. So that's why I'm raising the issue, and I've been raising this issue for when I was a Democratic committee man. It was called the Todd Plan. It's more than 10 years old, which says that in order for our city to North St. Louis, as well as the rest of our ward, which is south of Del Mar, and as well as our city, can function and ever grow, we must treat drugs as a health issue. And the current candidate for president, Biden, said that instead of having people in jail for drugs, we should have them in a hospital. They should be treated. It should be treated as a disease. So that's why I'm pushing, and with this, with our with what is the best practice, instead of the hate that is peddled morning, noon, and night on the different media about killings, about crime, and other things. We need to combat that with our main concerns, which is being our residents being safe. And since we're the stewards, as all the people of the budget, it is a waste of taxpayers' money to fund things that don't work. Let's say, for example, almost have our police budget, our budget going to public safety, almost half, when the public would be safer by treating drug addicts. We would have money for our capital. Our capital budget wouldn't be cut today in half if half of those people who shouldn't be in jail right now, if they were treated. So forestry, our lots and other things, which when those lots are not beautified and kept clean and that causes mental illness. We could have more money in forestry. I have streets in my ward, for example, that haven't been paid in 25 years or more. We could have our streets in Alice paid. Even though we have COVID-19, we are using many of the dollars that the voters voted for parks. We would be practicing social distance. We could have park rangers. We could have activities in our parks, while people right now, which is creating mental and physical health by sitting in the house, and our parks are just sitting idle, while we could have the type of supervision, type of safety, type of rangers and other things in our parks that would have people active under active supervision. But we can't do all of those type things because of the fact that on public safety, as well as the fact that we have speed bumps. We have on Page, I know in our ward, in Kings Highway, which runs all the way through the city from north to south, for example, people are speeding according to my residents. And if they speed down north of Del Mar and in the Central West End, which I represent part of the Central West End, I'm sure they're speeding in south all over our city. And we could be using some of that money to both educate people, as well as some people need a gentle reminder, which is called a traffic ticket. And we could have those speed radars reminding those who forget, and they're just going with the traffic flow. The main point is that until we deal with the cause and not the effect of most of the things we talk about, we will not only
Alderman Todd. I think we have a little bit of a frozen. Alderman Todd, I think we've lost you. Mr. Clerk, it appears that we've lost Alderman Todd.
Yes, I was noticing. Let me try. Oh, we lost him completely now. Okay.
Mr. Clerk, do we have any idea if Dr. Eccles is going to be joining us again to finish out Board Bill 153?
I see he's showing it's back on. He logged out. He's back on.
Okay. Let's go ahead and we will, since we've lost Alderman Todd and we've lost Dr. Eccles, we'll go ahead and move on just so we can cover the items for discussion. We had 2 items for discussion today, general update on COVID, our response and the hospital load, as well as just a kind of brief summary of what the response from the city's perspective on addressing our most vulnerable residents during the pandemic, the unhoused. We'll switch and start with item number 2. And perhaps get an update. We have Steve Conway with us, who can maybe speak on these issues, given Dr. Eccles is not here. Steve, as you know, yesterday was announced by the Metropolitan Pandemic Task Force. Yesterday was a record number of COVID-19 admissions to area hospitals, 72 admissions in one day, the highest number since tracking began in early April. Our healthcare systems on average, it's my understanding, are reported at 85% capacity. Statewide, our cases continue to rise. Can you go ahead and give us an update on what we should expect from the city moving forward as far as new restrictions, new actions by the city just to go ahead and address this alarming rate of rising cases of COVID-19 in our community?
Well, can you hear me, first of all?
Yes, thank you, Mr. Conway.
Okay, good. Okay.
Sometimes
I always have a little issues here. I would prefer, and my boss would also say that we would let Dr. Eccles answer those questions, and he'll be more than happy to do that. I know he did it Tuesday night with the alderman, and we do it every other day with Live with Lida. But I trust he'll be back online and be able to tell you what the actions are and what the strike points are.
Okay, are we anticipating any new restrictions coming on board from the administration outside of the health?
Those decisions are controlled by Dr. Eccles, and I do not want to put words in his mouth.
Can you hear me, Chair, Madam Chair? Hello?
No.
I think we're having some feedback, Alderman Todd.
I'm having let me turn this off. My internet I need to is having problems. So can you hear me now?
We're having a very hard time with that audio. Maybe we'll have to figure out how to get the audio function.
Sign out and try to sign back in.
So do you mind maybe if we could mute somebody? Okay, we'll have to figure out Alderman Todd. So, Mr. Conway, it sounds like the administration isn't prepared to update us on any further action. I understand we're waiting for Dr. Eccles. We planned this meeting last week. We knew we would be discussing this. And I understand that apparently there was a double booking here.
The doctor has the capacity to give you the update.
Okay, should we wait for him to return or what? Do you recommend that we do at this point?
Do you still hear the background noise?
Alderman Todd?
Yes.
Alderman Todd, it would be helpful so that we don't all lose our hearing.
Okay, thank you. I know that you had questions regarding our homeless outreach for this winter, and Valerie, Russell, and I are here to answer any of those questions.
Okay, well, we can go ahead and switch to that item here. We're striking out. So moving on to the fourth item that we're going to be discussing here today, we'll talk about homelessness. Mr. Conway and Ms. Russell, if you could give us an update on where we're going with that. I know last year, earlier this year, excuse me, it seems like years ago when the pandemic started, we struggled to coordinate some, we struggled on lots of fronts, as many cities did. Would you mind giving us an update of where we are coordinating with our community providers to ensure that our most vulnerable residents have access to be able to shelter in place should we need to come to that again?
Good morning. This is Valerie Russell, Director of the Department of Human Services. Can you hear me?
Thank you. We can hear you. We appreciate you being here today.
Currently in the city of St. Louis, we have approximately 650 beds that are available. Some of those are city-funded shelters that go year-round. And during the response to the pandemic, with CARES Act funds, approximately 245 additional beds were added. So the response has been relatively robust in that not only are we providing additional beds, food, PPE, supplies, cleaning and disinfecting apparatus for all of the providers. Those are operating on a daily basis and have been since end of March. We anticipate as of December 1st, an additional 171 beds to come online as capacity allows. The numbers that I'm giving you are the social distancing bed counts that the city-operated shelters have had to adjust to, as well as the numbers at the COVID and CARES Act funded shelters. During the winter months, we anticipate the process for sheltering individuals to be relatively similar to what the process was last year. There will be a warming bus that will be in place and will be transporting individuals to shelters. All of those shelters are being provided with cots and blankets, PPE, thermometers, and other supplies that will be needed and will keep their volunteers and paid staff safe. Excuse me. The total number of beds that we anticipate adding when the CARES Act funds can no longer be utilized will be approximately 305 beds, and those will be funded through HUD dollars that have been allocated through ESG 1, CV1, and CV2. So as you see beds go offline, if the federal government does not allow the additional time under the CARES Act, we will be bringing on new beds through the ESG CV1 and CV2 funds. Are there any questions?
Before we go into questions, I'll just ask you to clarify, just because I am a little bit confused about the numbers here. At the front end, we talked about 650 beds with an additional 245 beds. And then towards the end, we talked about 305 beds. I think I'm a little bit confused as to where the numbers lie. Would you mind maybe giving you just for clarification? Thank you.
Certainly. So there are city-funded shelter beds that go through the HUD dollars, ESG regular funds. There are 232 of those.
Okay, and those are right now?
Those are right now operating. They operate year-round.
Okay.
Those are the numbers based upon the CDC and the health departments and other medical professionals indicating that there had to be adjustments made for social distancing within those shelters.
Okay, and Ms. Russell, those are the beds that are funded through the typical annual allotment of HUD, is that right?
That's correct.
Okay, and then in addition to those 232, where did the 650 come in?
In addition to the 232, there are 245 beds that are being funded through the CARES Act. And as of December 1st, for winter, an additional 171 beds will come online. That makes up to 650.
Okay, so if we understand those numbers correctly, that 650 is the total, of which the 245 are additional beds as of the CARES Act funding, and another 171 as of December 1st.
December 1st.
Get that total.
Correct.
Okay. Okay, I have several other questions, but I'll turn it over to the committee. I really appreciate the update and taking time to be here with us today. And with that, I'll turn it over to the committee for questions. Alderwoman Tyus.
Good morning, Valerie and Stephen. How are you this morning?
Fine.
How many different shelters are included in this this bed count?
That's a good question. And I did not add them up. I will, however, if you allow me the time, kind of give you a rundown of what those are very briefly.
You can, you don't have to, if you don't have them, you can get back to me, or you just give me a approximation, and that has to be exacting.
20.
Okay. And so, as I understood it, once the CARES Act runs out, if it's not refunded, we will go down to 305. Did you say?
No. Once the CARES Act funds, if they cannot be utilized after December 31st, and those are the 245, our plans are to fund 305 beds, and that's approximate. There may be more, with funding that has now been made available by HUD, and that is ESG CV. The CV stands for Coronavirus CV 1 and 2. That's approximately about $10 million, but it's to be utilized not just for shelters, but all homeless services. So we have been releasing RFPs to secure additional services for homeless individuals. Categories under those RFPs include emergency shelters.
And Alderwoman, when we scheduled out, and I gave the alderman a full schedule, when we scheduled out, we knew originally that the CARES Act money had to run, had to be spent by 12/31. So we actually scheduled out intentionally then the next funds to start January 1st, 2021, because it had a longer expiration date so that we could cover both the whole winter and all of next year. There will not be any CARES Act funds left after 12/31 in the city of St. Louis. That we have scheduled our programming for the help across the board to make sure that we appropriately, effectively, and efficiently spent the funds to help the residents.
I unmuted myself on the computer. Can you hear me now?
Yes, Alderman Todd, we can hear you now.
Okay, you can hear me?
Yes.
Sorry, I had a computer problem. It went out. Thanks.
And our understanding is that Congress is not going to do anything between now and the end of the year as to the subsequent CARES Act 2 or 3, the HEROES Act and the HEALS Act, and all of the other acts. Our best guess is that Congress will not bring or address this issue until February of next year when we get a new Congress, a new president, and all of those things. So we're still on track to make sure that we can get all of our residents serviced with the funds that we have available.
What does it look like? And I know we never can know exact numbers, but what does our bed count look like in relationship to our homeless population? And I know this is just an approximation.
There has not been a recent point in time completed. However, I would have to go on and say that we do not have the number of beds to house all the individuals who are homeless.
I ask this very selfishly because ever since Larry Rice has closed down, we have an enormous population that has moved to the differing communities. We have had several houses where senior people left and died, and we literally have had the 4000, 3900 blocks, 4100 blocks go up in flames if they have gone into the houses and set them on fire trying to keep warm. And so I get back to, is there any chance that we can ever open back up Larry Rice's facility, which was open when I moved here in the 70s, and worked at the library, because although the people downtown might think it's an inconvenience for them, it's an inconvenience for all the fires we're having in my community now. It's an inconvenience for people not to have enough beds. So what is going on with that?
Alderwoman, that one is still in court. It got to the conditions was that it was unsafe and dangerous to the health of anyone that would be in there. He was only doing a nighttime sleepover. Now we provide the winter outreach and all of our services for the super cold period of times. Actually, we've expanded it so that it doesn't even have to be super cold starting December 1st. It doesn't matter what the temperature is. Everybody knows that we will take them to the shelter irregardless of the temperature. So that's called congregate sheltering, and that's just nighttime only. We bring the people to the shelters. They monitor who's got what space available. What I can tell you is the city has more city-funded beds today than we ever have. And then for the winter time, this winter, we'll have even more. We'll continue to add them. We continue to look for new locations for people. Part of the problem with the COC members is they have, with the pandemic, they've all cut the beds that they've made available. We've made available to them funds to put partitions, to get back some of their capacity in their minds. That only 3 of all of them have accepted any of the funding. So a couple of the members of the COC have been pretty good about expanding, but they are having experience problems. All of these members in the shelters and the not-for-profits, a lot of them are done with volunteers. A lot of their volunteers are elderly. They are having difficulty getting the employees that they need to do the work. And they're experiencing that, and we're experiencing that when we work with them. The most important thing is the city continues to build the number of beds available as compared to the rest of the population.
So I would differ slightly in saying that that's great that we're building more capacity, but it would seem like to me, I do not understand why we could not have somebody that was already doing this helped. The money that we're going to be in litigation and all of that, if it was that dangerous, why would the city wouldn't have come in and tried to help to build it up? I think it is a policy to try to move it downtown, move it away from downtown, and that is an unfair policy to me because anybody who wants the city life moved there when it was already there. So I will continue to say I am appalled that we couldn't find a way to keep that open. And it's not safe for all the people to be out in the streets in all the other neighborhoods as though downtown is much more important than all the neighborhoods where other people live. So it's very dangerous to my community where 91-year-olds live. And then right next to that, the houses are going up in flames. And I don't blame the homeless population or unhoused population because they're going to keep warm the best way they can. But I think we dropped the ball, not originally from this administration, but from the previous administration. But I wish that this administration would have picked it up, told the people downtown, you move downtown, this is here. We're going to keep it here. We're going to fix it up. We're going to make it housing for people instead of thinking that you can move downtown and move everybody out and push it to other neighborhoods because it is unfairly impacting my neighborhood, much of which is residential, and just having the houses. I mean, I'm going to send you some pictures of houses that were in perfect condition and just are burned down because I've been sending them to the public safety director to say, tear these houses down because there's nothing else can be done with them. So I appreciate that you may be expanding, but I don't appreciate that you weren't able to find a way to work with Reverend Rice, and that we could have kept this building fixed up in downtown. I don't think that if somebody is doing something and if it's not up to what we think safety should be, I don't see why we couldn't put the money in it. Most certainly we put enough money, and you and I got elected about the same time. We put a lot of money into stadiums. If we put just a little bit of that money that has gone into stadiums, into fixing up Larry Rice's place and helping him, I still think that's better than what we're getting now. I have no further questions. And I'll listen to you. I just have no further questions.
Thank you,
and Valerie, correct me if I'm wrong, but the New Life Evangelistic Center has never responded to any of our RFPs.
So what Steve is referring to is that the process for securing the funds that have been made available, both within the HUD dollars and with the RFPs that we've done with the CARES Act funds, we have not received any responses or requests for funding from the New Life Center.
Thank you so much for that reply. I appreciate it. And so I'm going to be quiet because you're not talking to new alder people. You're talking to somebody with as much seniority as Stephen Conway. And Valerie, you and I know each other from when I worked with food and housing and things. So I'm just going to be quiet. What I have to say, I'll put pen to paper. Thank you very much, Madam Chairwoman.
Thank you, Alderwoman, guys. Moving along, Alderwoman Ingracia joined us. Alderwoman Ingracia, did you have any questions about where we are in planning for funding services to our unhoused?
Thanks for asking. I joined too late, so I will. I'll rewatch everything and reach out directly if I have questions. Thank you, Madam Chair.
Yeah, appreciate it, Alderwoman Ingracia. Alderwoman Green.
I have no questions at this point in time.
Alderwoman Martin.
No questions. Thank you.
Alderwoman Middlebrook.
I have no questions. Thank you.
Alderwoman Rice.
Thank you, Madam Chair. Mr. Conroy, Ms. Russell, are we seeing increases in or unhoused population as the pandemic moves on? I know we are supposed to be holding most evictions for folks under federal guidance, but I do know that people have been locked out of homes and things. And are we seeing increases already out on the streets? Are we expecting increases as the pandemic continues?
This is Valerie speaking. I don't know that we've had the opportunity to get definitive information about whether or not the individuals who are seeking housing and shelter as a result of evictions. However, at the beginning of the pandemic, what we did experience was a number of individuals who were homeless coming to the St. Louis area from areas throughout the country, and those were individuals who were being queried because we were doing outreach to try to get them into these CARES Act locations. We asked where they were prior to seeking shelter. The funds that are being utilized right now from the CARES Act for rental and mortgage assistance are still in play. Those funds are still available, and we have 14 subcontractors who are trying to assist individuals so that the number of evictions are kept to a minimum. In addition, we have the courts who are providing through the Sheriff's Office the applications for the rental and mortgage assistance to those individuals who have court dates that are coming up on the docket related to evictions. We have also provided eviction mediation services so that individuals who are being evicted potentially can have someone intervene on their behalf to serve as a mediator between themselves and their landlords. And we've got legal services that have been provided. The Board of Aldermen was very instrumental in making certain that funds were made available. And we've got 2 subcontractors who are providing the legal services to help mitigate individuals losing their homes and or their rental property.
The one thing is the priority goes, and we have a lady in the family court, the priority goes to any eviction that otherwise would qualify for funding. So that those move. When we started this process, there were 44 of those, and the lady that's in charge over there got every of the 44 people that were originally scheduled for eviction, only one of them had applied for rental assistance. So now there's a process in place that she reaches out to everyone who has an eviction that would be for monetary purposes. We work closely. We continue to always ask the Judge Burleson to continue to extend the date. He is monitoring our numbers and our activities, and I think he's comfortable that we're reaching out to everyone that would otherwise qualify for economic funds. The whole purpose here is to prevent people from coming into the stream of homelessness. And heretofore, I believe that we have paid the rent directly to the landlord for north of 860 individuals, which I have not found another city of a population of 400,000 or less to even come close to the success rate that we have here in the city of St. Louis.
That's great. That's really great to hear that money is coming out. One further question I would ask, last year we were talking about long-term housing and actually, getting folks into long-term housing, and it seemed like we were making good strides towards having available spaces and getting folks into that. Ms. Russell, could you speak to where we're at on that this year? Are there continuing spaces available? Are we continuing to place people into housing?
I believe that you are referring to the Rapid Rehousing Program.
Yes, thank you.
That's funded through HUD. Yes, there are still programs operating through those HUD dollars to place individuals into housing, and a part of the ESG CV 1 and 2 funds that I mentioned earlier from HUD. One of the categories for the securing of subcontractors is to increase that number of individuals who would go into housing. Those bids have just been received, so I don't have any details. Just received, in fact, this past Monday, so that we can not at this time tell you how many units we will be able to fund. The Department of Mental Health is still funding vouchers for individuals under the supportive housing program as well. But the rapid rehousing funding is still a major priority within those ESG funds.
Okay, great. Thank you so much.
Do you have any further questions?
Oh, sorry. No further questions. Thanks.
Alderman Todd, do you have any questions?
I have a statement. First of all, let me say that I'm not looking for sympathy, but I also experienced on a personal level as a teenager homelessness, and we should be up in arms. There should be, and Reverend Larry Rice, thanks to him, that's good that he's doing that. But every human being, our goal should be every human being has a right to. That's a human right to have a home. And people saying it's welfare. No, let me just say that quickly. The working people, African Americans in particular, who are due reparations due to slavery, segregation, and currently being underpaid and currently not getting the services north of Delmar that we are paying for. At the same time, working people in general, anyone who falls into homelessness should immediately have a place to live. And that, from my experience, it's not even do you have shoes to wear. If you have summer shoes on, when you're homeless, you're going to have to either go barefoot, wear those shoes. And the same thing with clothing. And the same thing with when you freshen up, you don't have those type things. So not only, and you don't have the mask and other COVID-19 things that we need, as well as the flu season is coming. When you don't have a place to cook your food, you can't even get food stamps. When I was homeless, you had to have a place to cook your food if you you couldn't even qualify for food stamps. So therefore, it is very again, it is a health habit, both physical and mental. We should, and again, I'm just using the so-called public safety budget. It's ridiculous because of the fact that we could be using some of that money as stewards for the city. We must manage every penny wisely because we could be using some of that money again for homelessness, and that would make us safer, and that would reduce crime again and again. I would talk about the drug program that I'm trying to get us to begin to advocate later. But this is another example of why we cannot waste $80,000 a year keeping the workhouse open, and $30,000. We can house people in the Justice Center and the workhouse for $80,000 and the Justice Center for $30,000, but we can't build small houses for people to have a house. That's why we're going to have to change. We're going to have to prioritize how we spend our money. And it is the responsibility of everybody of goodwill as leaders to step up to the plate. If we can go to Jeff City and hire more and ask for more police, which studies show do not reduce crime, we certainly can go to Jeff City. We can go to Washington, D.C. and demand that we stop building bombs, rockets, and other weapons of mass destruction, as well as on the local level that we can stop and use that money to build houses. So we do have the resources, but the resources are being wasted on things that have been proven to not work. And those of us who stand back, as Dr. King said, and say nothing, we are actually complicit. We are complicit. And we know Holocausts have existed with other people, but we know of the Jewish Holocaust. Dr. King said that it wasn't Hitler that was so bad. It was the peoples who were silent. And this is genocide. When we sit back, let people die who could live, and do absolutely nothing about it and put communities in danger, as some of the people that mentioned would put the people in danger first. You put the person who in danger who has to start a fire to keep warm and to have a place to lay their head. And you put the residents in danger who have to live next door to a fire. So we must speak out, not just speak out, we must also make this a priority. And we also must use going to Jeff City as a model to get more policemen on the street, which we don't need, to do something. What will they do? They will put more people in the Justice Center and in the workhouse who we will have to pay $30,000 to keep them there, instead of pay that same money, since more policemen is ineffective, could be used to build houses, which would create jobs. And then we would be able to begin to use a model that solves the problem instead of perpetuating the same problem under the hate. So that they teach from morning, noon, and night about tough on crime, which only is a racist statement talking about tough on Black people. So that's my statement. So we're gonna have to challenge and stand up for what is right as leaders.
Thank you, Alderman Todd. I want to circle back to Alderwoman Green, who has an additional question for Mr. Conway.
Thank you. My question is about the rent and mortgage assistance coming from the CARES Act. So I've had a couple of constituents who have applied for the program, and the website says that they should hear something in 5 to 10 days. And they've been waiting over a month at this point in time with their mortgage coming due within the coming days. And so I guess if you could speak to me about sort of the amount of applications that are being received and the timeline or ability to get them through the system quickly. What should we be advising our constituents in terms of the timeline to actually receive funds and all of that?
All right. So the way the process has worked, United Way is the lead organization. They came up with a new software program in which the 14 or the 13 other providers are required to use, and it's called United, and they've all had their training. So United Way gets the actual application. It sends it out to the other 13 not-for-profit organizations, many of whom the names you're familiar with, the Urban League, Employment Connection, 180, Doorways, International Institute, but there's 13 of them, 14, I'm sorry, Catholic Charities, all of them doing a good job catching up, because the one thing is they all had to hire employees and train employees. Some of them already had experience. Some of our providers, and I'm monitoring weekly, very closely, all 14 providers, and one or two of them, or 3 or 4, are moving slower than others. And I have a person in my office that actually follows every Friday. We chase them down between Friday and Monday to see how they're doing. If there is a complaint on one application that isn't getting through, they can reach out to us or to the United Way, but they can reach out to us and we'll chase it down. I've done this for 1 or 2 of the other aldermen. Some of the providers, we got 4,500 applications right out of the box, and they are going through them one at a time, and we're up to 6,000 now. Many of the applications, the people don't respond back to us. Some of my providers have called these people 2 or 3 times, and I'm saying after 2 times, move on to the next application. So we will look at that one. Nobody's going to get foreclosed upon. Again, we would treat that like an eviction and move that up to the top, no matter which provider has the particular application.
Okay, so I should, if they haven't heard anything, I should have them contact.
Just send me an email, Alderwoman.
Okay, I will.
All right, thank you, Alderwoman Green. Mr. Conway, Ms. Russell, going into the winter, do we feel well prepared for being able to address what we're anticipating to be additional unhoused folks going into this winter in a general sense. And I guess a follow-up question would be, what can the Board of Aldermen, in particular the Health and Human Services Committee here, do to support a robust response?
I appreciate the statement you just made regarding the Board of Aldermen and what they can do to assist. What we have learned just in the last couple of days, for example, is that support that we've had in previous years from the St. Louis Winter Outreach volunteer shelters is being reduced dramatically, primarily because they cannot get the volunteers to assist them in the shelters. So if there are additional locations who would be interested in providing shelter either on a nightly basis, 1 or 2 times a week, or if they could expand beyond a few days a week, we can make available the supplies, the cots, the blankets, those types of materials and supplies, PPE, so that their volunteers and the individuals in the shelters can have the proper equipment to make sure that they're not passing along any other issues related to the flu or the coronavirus. As it relates to your question about do we believe that we're prepared, we are making all strides to ensure that as we find out about additional locations, that we work to get them online. Stephen mentioned earlier that there were funding available, that we put in an RFP to have some of the existing shelters increase their capacity. From that RFP, we have 3 shelters that are going to be receiving funds for construction and renovation so that they can add beds and space. We anticipate those being online starting the beginning of December through early February. So those agencies who have stepped up to the plate to make certain that they approach this in a different way, given the coronavirus and the type of safety measures that they have to take, that they are going to do so.
And, you know, I wish that we had a perfect crystal ball. We've planned this out from day one on those CARES funds, on the original spreadsheet I gave the aldermen. We showed that the ESG funds were for January. Continue to expand our capacity as needed. I guess there's 3 things that I think are important. Many people in our communities associate a bad stigma with our homeless people, and that is unfortunate. We are looking for locations throughout the city of St. Louis to expand our capacity. It is always difficult. Everybody wants to help us, but we would take any additional locations that we can get, not necessarily because I need them today, but as the economy crumples, we may need more. We have the funds in place for the rental and mortgage assistance. We have to take care, get it all spent by 12/31 because Congress hasn't extended it. We have $2.3 million sitting there for next year's rental and mortgage assistance, and that would only get, by the time I get to December, that might last me 1 month in January, but that's all that's out there for next year at this point in time. We've added another $500,000 to Heat Up St. Louis for utility assistance, and then next year there will be $2 million available for Heat Up St. Louis for utility assistance. So we'll continue to work that. We need just to have the ability to have more access to capacity building if the economy continues to get worse. That's what I'm asking. Let's reduce the stigma. Many of these homeless people are down on their luck. They have the capacity to get back on their feet and get back to, quote, a life where they have permanent housing. And we need to address that. Not everybody does drugs or everything else like that. We have a lot of people that are normal people that have been down on their luck, and we can get them back as soon as possible.
Okay, I appreciate that. I think a couple things. It sounds like with the winter outreach, with a reduction in capacity because of a lack of volunteers. It sounds like we are looking for additional space where we can provide materials. Have we issued an RFP to really outline for folks what they can expect from the city and what we're looking for in a sort of a partnership?
Yes, we have, and the responses to that RFP were received on October the 26th. Those RFPs are being reviewed now and will be submitted to the PSA committee and representatives from the COC to review to determine what is viable.
Okay, and Ms. Russell, I'm familiar with those RFPs. Did that include this additional winter outreach request for, the space, with the supplies and that sort of thing? I didn't read all the details of it.
Yes, it does.
That's great to hear. Mr. Conway, I think your point is well taken, that the stigma associated with the unhoused is one that is preventing some, that is a problem. And I know many of us would be happy to work and support any campaign or efforts to change the perception of our unhoused. And I think it can start by making sure that at all costs we are interacting in a humane and respectful manner, at every single opportunity. And if there's things that we can participate in to help change that stigma that the administration is taking on, please let us know. With that, I think we should move on. We want to be respectful of everyone's time. Alderwoman Tice, do you have an additional thought or question you'd like to add before we move on?
Yes, I wanted to know regarding the rent and mortgage. So can people apply more than one time? I have a person who got rent and mortgage for 2 months, then worked and looking to be unemployed again next year. Can they reapply, or is it a one-time only situation?
It is not a one-time only situation. If they received assistance, they can go back to the same agency that provided them the assistance, and they will reopen their case.
Okay, and how are they assigned agencies? Do they just fill out the application and then randomly they're assigned to the agency, or does an agency have certain areas in which they serve?
All 14 of the organizations that agreed to assist with this process have identified either geographic areas that they are interested in serving, or special populations, immigrants, individuals with disabilities, etc. The large majority of the providers will do things citywide. However, they do have limits to the number of cases that they can handle.
The other limitation is it has to be rent due after March 1st of 2020. We have a cap of $3,500 on the amount that can be paid out, and it was for 3 months.
The 3-month limit has been rescinded because we do have individuals who have rents that would keep them below the $3,500 cap, but they've still not been able to secure the employment or other resources that they needed.
And when they get, go ahead, I'm sorry.
The changes that we're working with our lobbyists in Washington, D.C., so that we can accommodate, there's a lot of problems that we've run into that we've gone back to Washington, D.C., regarding who actually qualifies, who's been negatively impacted by COVID. We've moved back the date of losing your job until November 1st of 2019 because nobody's hiring. We've done a number of things, but the key is in Washington, D.C., when they come up with the extension or the new act next year, we'll have a better menu of items that we see from our 14 providers that have to be addressed. And that we will make that, and I hope other people around the country, many places around the country aren't here yet, but they're going to see the same things that we're seeing in St. Louis. And we'll have a better menu of what our requests would be. Longer time period, a little more flexibility in what actually qualifies youth for being impacted by COVID-19. Those are the two biggest things that are making it difficult to process these applications. Because remember, this is all federal money, so I got to do it by the book because I am not going to pay back this money next year to the state or to the feds. We're doing it all by the book. That's why we have competent, qualified organizations doing it.
And this is just a question to you, because you know, or maybe other people know, I am a landlord. So when I hear we got to stay on evictions, and I've heard from a lot of small landlords, at what point is there some kind of payback to the landlord? Because if you continue to let landlords not get paid and the mortgages don't get paid, then things get cut off. The first thing you can do is not pay water bills. And if they turn off water, then you do evictions. What do you do about small landlords that maybe own 1 unit or 2 units or 3 units, and they depend on the rent to pay the mortgage for that building?
So what I would do, and I think we've actually pushed this out, that some of the landlords are more sophisticated than the tenants, is to tell the landlord to get their tenant to make the application. I mean, it's free rent if you make the application. The landlord benefits, the tenant benefits, and we're all better off. And I know in a couple of cases, you know, we have heard from landlords saying, you know, how do I get my tenant to apply? And so that's what I would encourage landlords to do, is to get their tenants to apply. It's a win-win for both of them.
Okay, I agree with that, but even going further, maybe a different conversation. At some point, we can't just say, don't pay the rent. And I'm not a business person that pushes business, but if your tenant will not apply or doesn't know how to, short of you doing it, which I would have no problem helping them do it. But then at what point do we have a landlord program? Is what I'm saying. Not for me, but other people that are small landlords, and maybe that tenant doesn't qualify for some reason. Have we thought about that? That I'm not talking about big millionaires. I'm talking about people that own 2 families and 3 families, and they can't afford to carry tenants.
So Nancy Pelosi's version, or the Democrats' version, at one point had, you know, that kind of covered. And I think as we get closer, because like I said, we're not going to have a new piece of legislation out of DC until February. As we get closer, the problem that you see with the small 2-family, 4-family owner, you know, the owner lives one side, not getting the rent, whatever the case might be, that pressure will continue to bubble up across the country. I don't have the perfect crystal ball, but I am comfortable I keep looking at all the drafts of these bills that are out there, and I'm comfortable that would be addressed. They'll probably extend 6 months, 9 months, what the rental assistance will be, the monies will be there. They will allow us to do direct mortgage aid instead of this convoluted process. We hope to see those things in the bills in DC.
Thank you. Appreciate it. I have no further questions. Thank you, Madam Chair.
Okay, thank you, Alderman Tyus. In the interest of moving forward, you know, I'd like to move on. Mr. Conway, we scheduled this hearing last week to conduct 2 items of business. You know, one being hearing Board Bill 153, getting an update on COVID, and getting an update on the response to our unhealth. I appreciate Ms. Russell and Mr. Conway being here today to accomplish that third piece. Unfortunately, Dr. Eccles, our acting director of health, was to assist us in addressing those other 2.
I believe he's online now.
We don't have him on screen in any way that I'm aware of.
At 11:29, he says he's on. I am sorry. Let me.
I'd like to go ahead and for
scheduling purpose. Can you hear me?
Yes, Dr. Eccles, we can hear you now.
Mm-hmm.
Okay. just to lay out how we're going to make it through the next 25 minutes so that we can get out of here by noon. Alderman Todd, I really appreciate you bringing Board Bill 36 before us. I think what we can do on that bill, you bring up an incredibly important issue with regards to treatment of addiction, specifically throughout our community. To move forward with that bill, I think we should work with the health department to identify what a fiscal impact would look like. And so I'd like to invite you to work with, I know Gerard Holland left us, but we'll have to put together what that looks like. And I'd be happy to assist in any meaningful way that I could. So we'll go ahead, since we did hear that bill, move it into the arena of taking a deeper look into it. I'd like to come back to Board Bill 153, and I'd also like to go through the line of questioning that we had regarding our city's response to COVID-19 following yesterday's extremely alarming information. But in the interest of time, Dr. Echols, if we could finish going through 153 so we can pass that out today, let's start there.
Okay.
You mentioned the website, stlcondoms.com. This site is no longer functioning. It's expired. Can you help us understand what the purpose of that site is and when it may or may not be up and running again?
Yeah, so that site was developed to make sure the community knew where STI screening or STI testing locations were in the St. Louis region. Okay. In addition to that, there were locations for the health department's condom distribution sites were also included on that site. So people, if they had financial issues and they couldn't afford to purchase sexual health resources, there were over 100 sites across the city and the county where individuals could go and obtain those resources at no cost.
Okay, but the site is no longer functioning, correct?
That's not my understanding. It should be up and running.
I went to stlcondoms.com and I'm informed that the site is expired. Our domain broker service may be able to get it for you. Click here to find out how.
Okay, I'll send you the link. I'm not in the office right now, but I can send it to you later today.
Okay, so it's not stlcondoms.com.
That's supposed to be the URL, but I'll send it to you when I get to the office.
Okay, I think if we have a website that is supposed to be, yeah, it's important that it would be up and running. Can you help me? One of the questions I get frequently is where people who have been exposed go to get a test within the city of St. Louis. There was some controversy just a couple of years ago about a no-bid contract that went to, I can't remember exactly who, related to providing testing. Where is testing available, city funded, within the city limits right now?
So this is in the city limits. The individuals can go to Project Art and The Spot, which are located near the campus of WashU. They can go to the City of St. Louis Department of Health Stop. And they can also go to other community-based organizations. So Williamson Associates, Vivint Health. Those are the primary clinics in the locations in the city of St. Louis where individuals can go for free testing.
Okay, I did some, just some quick looking over the weekend just to figure out, if I was a resident trying to figure out where I could go get tested if I felt like I'd been exposed. I had a very difficult, impossible time finding that information. I think it might be worthwhile to figure out where this website is, and if we could make sure it's on the city's website and direct people to where they could go get a test. Can you help us understand how the contact tracing is working with regards to STIs? I know that's an important piece of solving this issue in other cities. It's just tracking and informing individuals who have been exposed.
Right, so but before the start of my tenure as the acting director of health for the city of St. Louis, the previous director or acting director, Melba Moore, transitioned that service to the state. So the city of St. Louis, at the start of my tenure, did not conduct investigations for STIs and HIV. That the state is doing that for the region at this point.
state is doing that for the city of St. Louis currently?
For the city of St. Louis and St. Louis County.
The state of Missouri is conducting the contact tracing and the investigative.
That's correct. Yes, that's correct.
Oh, goodness.
And
Okay.
that's been the case since 2017.
Okay, so we're going to have some conversations with the state. I mean, the state of Missouri underfunds health to an incredible degree. I think we're number 49 out of 50 states as far as funding health services for our Missouri residents. And so I think it's important that we understand more about what the state is or is not doing, and how we as policymakers can, support moving towards a more robust system. Speaking of which, what can the Board of Aldermen do, Dr. Eccles, to support, what is missing from the equation? The Alderwoman from the 8th, Alderwoman Rice, mentioned earlier that, we have, excuse me, I lost my train of thought here. I was had a distraction. Let me start over. We have continued to see rising rates of STIs. They're continuing to go up. What is missing from the St. Louis City response to be able to bring those numbers down?
So the biggest challenge, as I mentioned before, is stigma. So not only stigma within the community, but also stigma just in general across government agencies, across communities of faith. There's a lot of stigma around sexual health. And so we really have to address the stigma associated with sexual health before we can really get individuals to accept the fact that sexual health is just a part of overall health. And so annual sexual health screening, sexual health and reproductive health screening should be obtained by everyone, at least on an annual basis. And for those who have higher risk factors, they should be screened more frequently. But until the stigma is removed or at least lessened, we'll continue to have these challenges in our community.
And what are we doing as a community to address the stigma?
Yeah, so the health department, we have a clergy advisory board. So we've been working with the clergy advisory board, and we have started having discussions with them about what some of the challenges are around having discussions on sexual and reproductive health. We also have a community focus. We've had focus groups, or we're having a focus group to talk about that as well, to get input from the community about what some of their challenges are around having discussions around sexual health and practicing, implementing behavior that would limit or at least reduce their potential for contracting sexually transmitted infections. And so getting that feedback from the community is really critical, and that will guide our decision making as it relates to initiative development and implementation, as well as messaging on these very sensitive issues.
So Dr. Eccles, if you could help us understand what that board looks like, I think it'd be very helpful. I think, the stigma is obviously an important piece, but without information about where to get tested and that testing and tracing, we heard it with COVID-19, and we also know it's incredibly important with addressing STIs. Any Google search of how, cities are dealing with that turns that up. And so it's critical that we have a way in which our residents can access testing sites and information about where they can go get testing. And so, I'm still failing sitting here trying to find where that website would be located and where information for a resident who's looking for a test would be, and understanding how the state is conducting our contact tracing and how robust or not robust that may or may not be is certainly a contributing factor to our extraordinarily alarming rates of STIs here in the city. I don't want to belabor that too much. I know we have a lot to do, and we want to ask you just a couple questions about what we're going to be expecting as far as a COVID-19 response. So let's go ahead and address the critical need of getting this board bill out of committee here today. Board Bill 153. I will entertain a motion on Board Bill 153. And excuse me, before I entertain that motion, let me ask if any committee members have any additional questions given that break on Board Bill 153 before entertaining motion. Seeing no questions from the committee, I'll entertain a motion on Board Bill 153.
So moved.
Second.
I assume that's a move to pass Board Bill 153 with a do pass recommendation.
Correct. Correct.
Thank you, Alderwoman Green. Moved and seconded by Alderwoman Rice. Madam Clerk, please call the roll.
Alderwoman Ingracia.
Aye.
Alderwoman Tyus.
Aye.
Alderwoman Green.
Aye.
Alderwoman Morton.
Aye.
Alderwoman Navarro.
Aye.
Alderwoman Middlebrook.
Aye. Aye.
Alderwoman Rice.
Aye, and I think that second was Alderwoman Ingracia.
Oh.
Alderman Todd.
Aye.
Chairwoman Spencer.
Aye.
9 aye votes.
Okay, moving along, Dr. Echols, we had also asked for an update. I'm not sure when you left us earlier, but we discussed very briefly the Metropolitan Task Force on the pandemic yesterday, announcing some extraordinarily alarming information that yesterday was the highest number of new admissions to hospitals since the pandemic started, since we started tracking those back in early April, 72 new admissions. We, according to news reports, our hospitals are at 85% capacity. Can you talk about what we should be expecting moving forward as far as a response from the city and what we can be informing our residents about what they can expect moving forward?
Absolutely, yes. So the data that's been shared by the St. Louis Metropolitan Pandemic Task Force is alarming. One of the questions that we raised with the Pandemic Task Force and the hospital systems was where we wanted to know where the patients were coming from. And so what we're seeing right now is a lot of the patients are actually coming from outside the St. Louis metropolitan area. And that's due to the fact that a lot of those jurisdictions do not have face covering mandates or social distancing mandates in place, similar to what we have in the city of St. Louis and St. Louis County. Along with that, other measures that we've implemented in the city of St. Louis aren't necessarily in place in other areas, such as making sure academic institutions have infection control plans in place for every school. So that goes for primary, secondary, and tertiary academic institutions. We've also established good relationships with the administrators as well as those individuals responsible for identifying individuals who need to be excluded, and making sure that information is reported to the health department in a timely manner to ensure that they're connected to the appropriate resources and excluded from the institution in a timely manner. In some cases, we've also been working with the schools to make sure individuals who are uninsured or underinsured are connected to medical homes. We've seen that a lot with individuals who test positive for COVID-19, as well as those who are under investigation for COVID-19. They just don't have they're not connected to a medical primary care provider. And so the health department, since March, we've been working with the St. Louis Integrated Health Network to connect those individuals to medical homes to ensure that they're not only monitored for COVID-19, but that they're also can have preventive health services moving forward beyond COVID-19. So that's been really critical. But overall, we're working really hard to address some of the systemic issues that have led to the pre-existing inequities and disparities that have impacted our most vulnerable communities. We also continue to do outreach through our community partners, such as Prepare STL, Dr. LJ Punch and her team, as well as the Regional Health Commission, to make sure that our most vulnerable communities are being reached. So they were still doing canvassing and providing PPE and other resources to the community to make sure that they could protect themselves in a way that's compliant with the city requirements. But we also did more education. So we've been using our media outlets to inform the community about what's happening, as well as remind them of the face covering and social distancing requirements in the city of St. Louis, as well as those other requirements, which include regular hand washing with soap and water and staying home if you're ill. Those simple measures that have proven to be effective in slowing the transmission of COVID-19 has worked in the city of St. Louis. And what we've seen is that more individuals across our communities are actually doing that. And that's why when we look at the increase in the number of cases right now, I believe we're averaging about between 50 to 55 cases. So we've seen roughly a 30 to 35% increase in the number of COVID-19 cases that are reported in the city of St. Louis over the 7-day average. But we're hoping that as we continue to work with our media partners, as well as the academic institutions and our community-based organizations, that we'll be able to continue to slow the spread of COVID-19. Again, we have seen the increase in the number of cases, but it hasn't been as great as what they're seeing in surrounding areas. But as we all know, we have a very mobile population across the St. Louis region. And so we're not immune or protected from having an increase. And so we have to continue our efforts that are ongoing to make sure that we are to make sure that the community has the information and the resources that it needs to protect themselves.
Thank you, Dr. Eccles. If you could help us
and you asked about moving forward, what the community can expect. So we're monitoring the data really closely. So, we look at the hospital data, but we also look at the city-specific data as well as the other community-based data that's published by the local health departments. And we use that to guide our decision-making. What we're seeing right now is through the cases that are being investigated, that a lot of the exposures are occurring not necessarily in businesses, but it's occurring in private residences where individuals are having small social gatherings. And so we're working with the academic institution, particularly college age, to more effectively reach college age students of those individuals aged 20 to 39, which account for the highest percentage of individuals being diagnosed with COVID-19, to make sure they get the message and they understand it. We understand that behavior change is difficult, especially amongst that age group, because there's oftentimes a sense of invisibility. But we have to remind them that protecting themselves is also protecting their families. And so we've been, again, working with our media outlets as well as our other stakeholders to get information and resources to that group as best we can.
So Dr. Eccles, I think are we looking at additional restrictions? Are we looking at preparing, with the 85% hospital capacity? What are the functional things moving down the pipeline that we can expect, or we should be informing people to be maybe expecting?
Absolutely. So, it's a very fluid situation. And so we're always looking at considering what additional measures can be implemented to further slow the spread of COVID-19. But we also have to follow the information we're getting from the cases that are being investigated. So, enforcing or limiting what happens in private homes can be very difficult. And so we're again working with our community partners to make sure people are informed about what needs to happen to protect themselves as well as their loved ones. But as we continue to look at the data, and get information from individuals that are testing positive, those things will inform what additional mitigation measures will be implemented.
Are we looking at any additional mitigation efforts in the near future? Are we looking at additional restrictions coming down to the community at this time?
So right now it's on our radar because of the trajectory of not only what's happening in the city, but in surrounding areas. So we are considering adding some additional mitigation measures, but nothing in the immediate future. So nothing will likely change today.
Should we expect anything over the weekend, or as far as additional restrictions or mitigation strategies, as far as directives from the city of St. Louis? I think what is frustrating for us as well as the community is not knowing what could be coming down, and without having being aware of what is being considered or a timeline, it puts businesses and individuals up in an unknown situation. So we're trying to help inform our businesses on whether or not there's going to be additional restrictions coming down the pipeline, if that's on the table. I don't want to, We're just
Right,
trying to best inform our community.
Right. So we do our best to get information out to the community in a timely manner. Right now, we're monitoring the data, and so we would encourage the business owners as well as City of St. Louis residents to follow the data. We update our dashboard daily. We also send out information to all of our stakeholders so they're aware of what we're seeing in the City of St. Louis specifically. But as we monitor the data and we identify the need for additional mitigation measures in the City of St. Louis, we will continue to work to make sure the community is informed in a timely manner, so that they can prepare themselves for whatever those additional mitigation measures may be.
But what I'm hearing right now is that we're not identifying any particular mitigation strategies that we're considering, nor are we providing any even estimate of a timeline of when the community could expect to hear from the city. It's all, we understand it's very fluid, but giving some sort of heads up would be very, very, very helpful.
Yes, and that we'll actually do that. So as I mentioned before, so we'll give timely notice to the community at large about any additional mitigation measures that will be implemented.
So what I'm hearing from you is that we're not going to make any announcements today, but that doesn't inhibit us or preclude us from making an announcement tomorrow. Are we expecting?
And that's correct. So we look at the data daily. The data changes daily. And so to say, we want to make sure that whatever we're implementing as it relates to mitigation strategies, we have to be mindful also of the unintended consequences associated with that. So we don't make these decisions in silos. So we actually think through what the mitigation measures will be, because we not only take into consideration COVID-19, but again, all these other unintended consequences that adversely impact our residents.
And I presume that you're going to be working with the director of St. Louis County Health Department as well to make sure that we're approaching this from a regional perspective.
Absolutely. So we work with the St. Louis County Department of Public Health, as well as St. Charles County, Jefferson and Franklin County Health Departments as well, along with the St. Louis Metropolitan Pandemic Task Force.
Okay, so again, I'm not hearing any particulars. I understand it's very, very fluid, but I'll just continue to reiterate that, letting the community know what may be on the table that we're maybe considering would be enormously helpful. It's very frustrating to not have any idea of what may or may not be, if we may or may not be, considering specific restrictions. Are we anticipating the hospitals to get overrun and to get at capacity? And do we have a plan for that if that were to happen?
So the hospitals do have a surge capacity and a surge plan in place, and that plan was established early on, and the plan was for them to have a tertiary care center, which was stood up for a short period of time. However, because the number of cases actually decreased, they didn't need to sustain that tertiary care center. However, we also have to be mindful, as the number of cases increase, the physicians and other medical providers, the staffing is limited. And so I believe, as one of the individuals said, they can create additional spaces. They can particularly restructure how they're doing some of their operations, but they cannot add additional staff. And so the staff capacity is really something that they're paying close attention to. They do have metrics in place. So as they are reaching thresholds, they will make internal decisions. Each hospital system will make internal decisions about what strategies they need to implement to protect their staff, but also ensure that they can continue to provide sound medical services for the communities.
Okay.
And I also want to make sure that everyone knows. So every Tuesday there's a COVID-19 update that myself, that the mayor has scheduled, and I provide an update. And so we provide that information, provide updated information to elected officials that attend. And so that's another good way for alderpersons to obtain information about what may be in the pipeline for COVID-19.
Sure, I think it's helpful to, beyond the alderpersons, to make sure that the community is updated with that information as well. I just realized that Alderwoman Tyus had her hand raised. It's noon. I have to exit this meeting, but I would like to, if Alderwoman Tyus, given you have questions, I'd like to hand over the meeting to you. you're able to.
I lowered my hand. I'm sorry. No, I don't have any questions. That was up there. Sorry.
Okay. I hate to, end this without having taken questions from the committee on this incredibly important issue. Dr. Eccles, I hope you would consider coming back to our committee, holding another hearing again very soon, and we can get an update on some of that STI situation with the website and where all the testing is being done, so we can have an opportunity to look at that. Perhaps you can send that to us via email, and we can continue to maybe talk about this as the events unfold.
Absolutely.
Okay, I appreciate you coming to us before us today. And with that, I'd like to go ahead and call and entertain a motion to
adjourn.
To adjourn. Excuse me, I was just thinking we did not excuse Alderman. We need to make a note that Alderwoman Navarro was under excused absence. Madam Clerk, I'm not sure if we had any other absences that were excused, but I'd like to put a caveat in there that we had several hearings at the same time, and that may have been the case. So with that, I'll take a motion. Thank you, Alderwoman Tyus, to adjourn.
I move to adjourn. Second.
Okay, thank you. Meeting adjourned.